Testing the urine. It's that anxiety-provoking task at the doctor's office where you see the cup slowly start filling up to the top, and thanks to the diet soda you had earlier, you're nowhere near done yet. Anyways, there's a lot of information that can be gained from a simple urine test. Let's get into it. When a doctor orders a urine test, what exactly is he or she looking for? Well, there's a lot. Let's start with a simple urine dipstick. This is also known as a urinalysis. This is when the urine is tested for things like pH, that's the acidity level in the urine. You can also test specific gravity. This can give you a sense of how dilute the urine is. You can also check for sugar in the urine. If there's a lot of sugar, this can indicate diabetes. There's other tests. You can look for protein in the urine. Very high protein levels can suggest kidney problems such as nephrotic syndrome. Then you can also check for leukocyte esterase and nitrite. If these are elevated, these can raise concern for an infection. So there's a lot of information that can be gained right away with the urine dipstick. These results are available pretty much immediately after the urine is collected. The next test we do is urine microscopy. So this is a little more detailed. This is where the urine is examined under a microscope. Here you're looking for red blood cells. If you see red blood cells, this can indicate blood in the urine. Maybe the blood was too small to be noticeable by inspecting the urine, but on microscopy you can see it. We call this microscopic hematuria. It can indicate problems with the bladder or perhaps kidney stones. Next, we check for white blood cells. If these are elevated, this is called pyuria. This can also be a sign for a urinary tract infection. And honestly, I find this to be a little more useful than just the positive leukocyte esterase, for example, which is more nonspecific. Urine microscopy can also be used to look for bacteria as well, which can also provide evidence of a urinary tract infection. But even better than that, for looking for infection, is a urine culture. So this is where a urine sample is taken to the lab where it's incubated for several days. And here we're actually trying to grow bacteria. So this is very useful because you can not only identify the type of bacteria causing the urinary tract infection, it could be E. coli or Klebsiella or Enterococcus. Not only can you identify the bacteria, but you can also test it for antibiotic susceptibility to see if the bacteria is resistant to any of the common antibiotics that we use. This helps to guide treatment so that we know that the antibiotics we're prescribing to treat the infection will be effective. But that's not all we're looking for in the urine. We can also check for urine electrolytes and urine creatinine. These can give us a sense of how the kidneys are functioning. And if there is kidney dysfunction, looking at the urine electrolytes and calculating what's called a fractional excretion of sodium can help us get an idea as to what might be causing the kidney dysfunction. Is it dehydration or is it a problem with the actual kidneys themselves? Moving on, there's other tests that you can do with the urine. There's the urine pregnancy test. This one's pretty commonly done. You can even do it at home, but it's also a common test that we do in the emergency department as well. Then there's drug testing. You can test for illicit substances like methamphetamine, cocaine, opioids, benzodiazepines. You can also check for THC in the urine. You can also check the urine for evidence of infection elsewhere in the body. For example, urine strep and urine legionella are tests that you can do to look for bacteria that can cause a pneumonia. Okay, those are some of the common tests that a doctor might order to investigate the urine. And a little funny story here, back when I was in medical school, when we were learning about all this, they had us actually submit urine samples from ourselves to the laboratory. And I can't help but think maybe they were running some little top secret drug tests or something, trying to keep tabs on the students. But I don't know. I don't have proof of that. But anyways, it's pretty common to get these tests. So if you go in to see your doctor in clinic or certainly in the emergency department, especially if you have a concern like painful urination, burning with urination, maybe pain in the flanks, in the kidneys, don't be surprised if a doctor asks you to pee into a cup for analysis. Okay, thanks for checking out this video. I know this was a pretty quick one, but if you like healthcare related content like this, feel free to hit the subscribe button there or check out another video right here. And I'll see you guys next time.